Enlarged prostate or benign prostatic hyperplasia happens to men after the age of 30. Generally, the prostate will grow between 1 to 3% per year. As it grows, it'll tend to squeeze on the prostatic urethra, or the channel of the urine that drains from the bladder out to the penis. This will be associated with weak stream, dribbling, and starting and stopping your flow. In general, the symptoms of benign prostatic hyperplasia or enlarged prostate are urgency, frequency, weak stream, dribbling, trouble starting, and trouble stopping the flow. This is because the prostate is squeezing on the urethra, so the bladder's overworking. So in general, you don't feel the enlarged prostate, you just feel that your bladder is upset because it's working harder to empty the bladder. BPH, or enlarged prostate, is caused by elevations of 5-alpha reductase, or a hormone that's in men causes facial hair. As you get older, this enzyme will increase its activity and cause enlargement of your prostate. There is no real way to prevent this other than possibly taking finasteride, which has other sexual side effects. The treatments for enlarged prostate can vary between nutraceutical therapies, which have minimal efficacy, to pills such as tamsulosin, Rapaflo, and finasteride. These have their side effects that can be sexually affecting you in the ability to ejaculate and also cause erectile dysfunction. Other options include urolift, where we staple the prostatic channel open. This is nice as it's reversible, and also we can control how much the prostate's opened. We can also use steam therapy in the form of Rezum. This does not leave any staples inside the body and causes vapor to cause the coagulative necrosis and shrinkage of the overall prostate. We can also use a procedure called Aqua Ablation, which will cause the prostate to be cored out on the inside using water. We can also use modified TURP in the form of green light. The green light surgical laser procedure allows us to do a TURP on blood thinners and allows us to vaporize the prostatic tissue. This can cause ejaculatory dysfunction. We can also use the old-fashioned TURP, which is not done as much for regular-sized prostates, which can also cause ejaculatory dysfunction, where we remove the prostatic tissue by scraping it out. Every patient is different, and we need to see what your prostatic volume size is by doing ultrasounds, prostate exams, and checking PSAs. In general, I like to start patients on more conservative approaches, such as pills, or minimally invasive procedures, such as urolift or Rezum. If we delay treating your enlarged prostate, you may affect your bladder and your kidneys. As your bladder won't completely empty, you'll continue to have urgency and frequency, and you can ultimately have bladder failure, where your bladder no longer can squeeze, and you have to empty your bladder by passing a catheter into your bladder to empty it several times a day. Also, if you don't treat your enlarged prostate, this can also reflux urine back up into the kidneys, causing kidney injury and renal insufficiency.